Hi, my name is Gabby Rubalcava, and my persuasive speech is over why euthanasia should be legalized. Okay, so euthanasia is a huge subject of controversy, and some people consider it murder and others consider it a possible medical route. To start off, Wikipedia describes euthanasia as the practice of intentionally ending a life to relieve pain and suffering. This could be because of a painful terminal disease like cancer, an irreversible coma, paralysis, or practically any other disease where medicine is no longer an option for the patient. According to the National Center for Biotechnical Information, in order for there to be an option for euthanasia, there has to be a request that is voluntary, well-considered, informed, and persistent over time. In other words, it can't be a spur-of-the-moment decision. There are three categories of euthanasia: voluntary, non-voluntary, and involuntary. Voluntary is where a doctor gets a request from the patient themselves and is actually considered legal in some parts of the world. Non-voluntary is illegal in all countries and is where the patient's consent is unavailable, whether it is not given or the patient is not coherent enough to give it. However, the Medical News Today journal states consent can be given on a patient's behalf based on the quality of life and suffering. Involuntary euthanasia is considered murder and is 100% illegal everywhere because it is in fact involuntary and given without their permission and against their will. There are two types of euthanasia, and they are passive and active. Passive, as told by the Medical News Today journal, is a route taken by doctors where life-sustaining treatments are withheld. For example, this would be a situation in which the doctor would give the patient opioids to just ease the pain instead of an actual medication, and they would just be given like morphine. Active euthanasia is another route that is taken where the doctor gives lethal substances or forces to end the patient's life. For the moment, euthanasia is legal in 4 countries: Switzerland, Belgium, Luxembourg, and the Netherlands. In the article, should euthanasia or physician-assisted suicide be illegal, it states that only Oregon, Washington, Montana, Colorado, Vermont, and California have legalized it. When compared to the rest of the world, euthanasia is legal in more states in the United States than in the entire world. However, euthanasia has been a popular debate topic since about the 1800s, and it wasn't actually until 1994 that Oregon passed the Death with Dignity Act that doctors were allowed to assist the terminal patients who were not expected to live past 6 months. As for questions about euthanasia and why it is used and how it is used, and why not just use hospice care, for why it is used, they are normally because it is a terminal disease in which they are paralyzed or will be in a coma, or medication is no longer an option. So the patients choose euthanasia because they have a right to refuse the medical treatment, such as prescriptions and surgeries, and they just go for the pills that are euthanasia, and the doctor prescribes them. And in Oregon, under the Death with Dignity Act, it states that 60% of the patients that took secobarbital and 39% of the patients that took pentobarbital, where the therapeutic dosage is between 100 and 200 milligrams, for euthanasia dose, the doctor actually prescribes around 900 to 1,000. In regards to hospice care versus euthanasia, there are some pros and cons. With hospice, depending on what you can afford and what your options are, you can either be in a facility or in your own home. Either way, there will be around-the-clock care and assistance if you should need it. With hospice, the patient can only take so much medicine. If they have already taken the allotted amount for Tylenol for the day and they are still in pain, then that is all hospice can do. That would be considered more of a con. Also, with hospice, the patient is pretty much waiting to die. I mean, this is a terrible situation where the patient would pretty much be lying in agony for weeks. But with euthanasia, you will be able to have your family around. God forbid if you were at hospice and something were to happen, your family wouldn't be there. But with euthanasia, they would be around. You'd be surrounded by your loved ones in a comfortable place where you wouldn't be in pain anymore. Depending on how you look at it, people will argue that it is humane or inhumane. It can be seen as inhumane, and some call it murder, and pretty much based on religious reasons, and the Hippocratic Act, which actually states that for a doctor, it states, "I will never give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect." Coming from the Medical News Today journal, and while all these are valid arguments on whether or not it is humane or not, shouldn't all doctors be held to the same standard? And no matter what their specialty, shouldn't they all be held to this oath? If you think so, then why is it okay for veterinarians to put animals down? Shouldn't euthanasia be legalized too, but for adults or humans? This is a double standard, and I would just like to let it be known and to persuade people to look and think about it from the point of view that you are actually saving a human being from suffering and living in so much pain to the point where medicine can no longer help them. If we can do the same, and it's legal for our loved animals who cannot speak for themselves, then why can't we make it legal for our loved ones who can speak up for themselves and tell us how they are feeling? If we legalize it, not only are you helping the patients with their unbearable pain, but you are also giving them a sense of peace and closure, but for both them and their family. Like euthanasia.com states, you are giving them the power of choice. You are giving them a chance to say goodbye. Why can't all doctors be held to the same standards? And this is why I think we should legalize euthanasia, because it helps. It really does.